It's going to say intermittent, okay? So make sure that you get the right tray. If you get in your procedure and it doesn't have betadine in there, or if it doesn't have gel in there, guess whose fault it is? Because you're gonna have time to look through that tray before you start, okay? All right? I wish that everybody could get a new tray every time, but that's a little much, okay? Because you're doing you're doing all your practice hours, right? And all of that. You'll get your a new one when you first open it up today. You'll get a new one, okay? But after that, yeah, make sure everything's in there correctly, okay? All right. So now intermittent, I'm still doing all those same things, right? All those still, the exact same things that I would do with my regular Foley catheter, I'm doing with my intermittent catheter. So making sure my hands are, I come in, introduce myself, my hands are washed, provide for privacy, name, date of birth, look at their armband. Are you allergic to betadine, iodine, latex, shellfish, and silver? No? Okay. All right, well, the doctor has ordered that I get some urine. It has to be some clean urine. So I have to put a catheter in your bladder to let your urine drain from your bladder, and then I'll take it right back out. Okay, so same things again. I need to do peri-care, so I'm putting my wall gloves on. My hands were washed when I came in. Rolling this back. I'm going to expose you now. Okay. All right. So this gentleman has foreskin. What did I tell you when giving a bath about foreskin for a male?
Pull it back.
Pull it back, wash. So I'm washing from the abdomen to the knees. Then the peri area, I'm going to pull that foreskin back, wash that area, and put that skin back. And then I am going to wash the anus area. Putting in that dorsal recumbent. Dorsal recumbent is with the knees bent for most males. We just spread the legs, okay? All right, as wide as you can get them, all right? So now I've done peri-care. I'm going to take my gloves off. Wash my hands again. Open up my tray. It says intermittent, meaning in and out. So I'm going to open up my tray. Okay. Use this as my trash. Put my tray right in the middle. I don't need this part. I don't need this part. I just did peri-care. I don't need the directions. Okay. I open away from me and then toward me. Don't need that part. Okay. Opening, maintaining that 1 inch border away from me. And then to the sides. Okay. And then toward me. Okay. There's my gloves. So what time is it? Time to put my sterile gloves on. Okay. So I'm going to pinch this to get this out of there. And put my gloves on. I put these on the wrong side, so I gotta switch them, staying on. Okay. All right. Pinching with this hand. Lifting up, making sure that I'm keeping my sterile filled. My thumb is up. Getting my cuff underneath here. Lifting up. Making sure this is on. Okay, I'm done. Did I maintain sterile field? No, why? That's right. My table was not in front, okay? So I would have failed, right? Okay, so, making sure, hate it when I get air in there, okay. All right, so now I gotta put my drape on here, okay? Remember, shiny side down, see the shiny side? I like doing it long ways, okay? And I'm gonna drop it. I can fix it later. Put this on top. Do my fenestrated drape. Okay. Bring it up and drop it, back it in, right? So now here's my betadine. It's basically the same. Put my betadine on there, open everything up. Here's my lube for males. How much lube do I put on here?
4 to 5 inches.
4 to 5 inches, because their urethra is longer because of the shaft of the penis. Okay? And then I don't have any saline because they don't have a bulb, because I'm gonna put it in, collect my urine, and take it right back out, okay? All right, so now, I'm gonna fix all of my work I've done here, making sure I keep everything sterile, okay? All right. If it's better if you can get that drape underneath that penis before you start, so that you don't risk getting unsterile doing that, okay? All right, so now I need to clean this. What do I need to do first?
Ask allergies.
Okay, I asked allergies already when I first came in the room, okay? But what do I need to do first for this male? Remove the foreskin. So now I'm going to become unsterile on this hand, okay? So I gotta pull back that foreskin, okay? And when you do males, you're gonna put this male at a 60 to 90 degree area. So 90 degrees straight up and down. I'm going to, I find that is the best way to get this Foley catheter in, is if you hold it straight up and down at a 90-degree angle, okay? Then I'm gonna wash. So I'm gonna wash starting at the meatus and wash around, okay? Take this out, down and around. And then with betadine, you would be able to see where you left off. So then I'm gonna start where I left off, okay? And wash this around, okay? And then my last one, I'm gonna start again at the meatus and do a second time there, because that's the cleanest part. We want it really clean, okay? And then out and around. So the only difference between this and an indwelling catheter for a male is that you would have that bulb that you have to blow up. Everything else is the same, okay? And then you keep the bag in. So now I'm gonna tell him, okay, you're gonna feel a little discomfort. I want you to take a nice deep breath, blow it out, and then you're gonna put this directly in, okay? Again, make sure you're not hitting the tip of that, okay? Because then you become unsterile, so you have to walk your fingers back. And many times you have to go all the way to this end part for males. But if you stop once you get urine back, and then I'm gonna stabilize it by touching that, okay? And then much further does it say to go in?
2 more inches.
2 more inches if you have that space, because you might have to be all the way up here anyway. But then you go in 2 more inches, okay? but I would have done that before I touched it, okay? Everybody understand that? Okay. All right, so now, that goes in. And now for this, I'm gonna make sure, this is closed so that it doesn't drain out, and I'm just gonna hold it there and let that urine drain out, okay? And that's, what we wanna do is to test how much urine is still in there. So I just go, oh, how are you doing? Oh, you're doing good? Okay, good. It's kind of weird because now you're, okay? But that's all you're doing is standing here waiting for the urine to come out. And then once it's done, you don't see any more coming out, I'm clipping this shut, okay? Clamping it shut, and then I'm going to pull this out just like I did with the female. And then you're gonna say, okay, you're gonna feel a little discomfort, and then you're going to pinch and roll this up again so it doesn't flip out in your face, okay? And pull this out, okay? You don't do it super slow, you don't do it super fast. And then I'm going to pull this foreskin back, all right? Remember, you need to put that foreskin back as soon as possible, okay? But then once I'm done here, I'm gonna put all this in there. I'm gonna record how much this is. I'm gonna record coca again, make sure I have it in my head, so I can document that later. When you document this, it's going to be whatever French catheter it is, and you're gonna have to put it in and take it right back out. That's how you do it in Epic, okay? So you have to put one in, and then you have to go back in and take it back out, okay? That's how you do in and out. So, get rid of this tray. And, I don't, then I'm going to, get rid of all of my things. Please don't rip this off because we use these again, okay? Make sure you, keep it nice. Okay, then I'm going to do pericure, okay? Making sure that I take this back and get that betadine off that I put on there, okay? If you have a uncircumcised male, okay? Questions about this? Then I'm gonna put him back where he belongs. Okay? Put his gown down. Put his bed back down in the right position. Give him his call light. Okay?
I have
All right.
a
Question.
Okay, so this would be for pediatrics. For a Foley cath in an uncircumcised male, since their foreskin cannot retract technically, how do we do that? Would we do that? Or is there a separate, do we just put a bag over them?
Well, it's gonna be whatever your facility requires, but,
Okay.
many times, my experience, I don't know what Mercy does for pediatrics, cause I just don't know. Maybe you'll get that when you get into the pediatric part. But we usually use the U-bag, like a external catheter for them. Okay, but we have to wash it, still have to wash it nice
Yeah.
and clean, and
Okay.